Well, my name is Augustine. Last name is Eze, E-Z-E. I was born in Nigeria, and I came to the United States as a teenager. In fact, I came in when I was 17, and went to undergraduate school at George Washington University in Washington, D.C. After that, I did chemistry major and mathematics minor. Finished my undergraduate degree in 3 years, and then went to Georgetown Medical School. Finished in Georgetown. I finished in 1987, and after that, I did a rotating internship at New Orleans Charity Hospital in New Orleans, and that's where I met my wife, Teresa. And I did the 1 year there, and then decided to go into surgery. Did 2 years at Syracuse. That's where I did my general surgery internship and assistant residency. Then went down to Harlem Hospital in New York and finished my general surgery training. At the completion of general surgery training, I went down to Temple University in Philadelphia, and that's where I did my vascular fellowship. And since then, since 1996, I've moved to North Carolina, and I've been covering hospitals, Kings Mountain, Gastonia, and Charlotte. I do general surgery and vascular surgery. In fact, when I came here, I was the first, although Kings Mountain was doing vascular by one of the surgeons who was there, but they were not really doing extensive vascular. When I came down to Kings Mountain, we initiated a vascular program, really. And since then, we are now doing both stents at Kings Mountain and doing a lot of vascular cases. And of course, I do general surgery also. Well, vascular surgery is treatment of blood vessels, basically disease of the blood vessels, mainly the ones that affect the blood vessels outside of the heart. And that will involve blood vessels that supply the brain, that if they get blocked, you get a stroke. We operate on patients to clean that out. There is also new procedure now to do stent if the patient is too sick to undergo surgery. We also operate on aneurysms. Also, people that have blockages in the arteries in their leg, either secondary to diabetes or some of the things that are very common, high blood pressure, they get blockages and get gangrene. We try to operate on them before the gangrene sets place. Even when the gangrene is there, we operate on them. Maybe if they have gangrene of the toe, we remove the toe, give them good blood supply, and it will heal, and they avoid amputation. We do that at Kings Mountain, and it has been very successful. I operated at Carolinas Medical Center. I operate at Presbyterian Hospital now. I used to be at Gaston Memorial Hospital. And I will tell you, I like Kings Mountain in that I've had over the 14 years we've been at Kings Mountain, we have had almost the same group of people that help you. It's almost like you getting your assistant. And then over the years, Kings Mountain has undergone a transition where they have improved the surgical suite, such that the surgical suite is first class in any hospital. And this is what I tell my patients, that I am the surgeon. I operate at Kings Mountain, and I operate on all these hospitals. If you come to Kings Mountain, you get the same service that you get at any other hospital that I go to. You have the same thing, or if not better, because they are smaller, they pay more attention to you, and our outcomes are very, very good. Of course, this is not hidden. It's in the papers. It's published. It's Medicare. The results that we have at Kings Mountain is well known and not questionable at all. Overall, the staff is great. They attend to patients on an individual basis. and I have enjoyed the staff at Kings Mountain. The key thing though is that most of the people that are there have remained, and they have done very, very well. They have remained on staff, and that helps with continuity of care. And surprisingly, most of my patients that have never heard of Kings Mountain, when they go there, they say, "Man, I never heard of this. Man, this is great. I was treated like a king." Well, that is the most attractive part of being in Kings Mountain, the togetherness of the physicians, communal relationship between physicians that makes patient care better. In my opinion, I could, if I get consulted by a physician, to see a patient, I go and see the patient. I call him. I say, "Hey, this is what we're gonna do." The physician then helps me explaining that to the patient, because the patients know the physician better, and we have that relationship. We have also other specialists that have begun to come into Kings Mountain, including the orthopedics. In fact, I know of the orthopedic surgeons that have really closed Friday off. They do all their surgery at Kings Mountain. We have a dental surgeon that comes there, and then we have an ophthalmologist that takes patients from all over the country, and they come to Kings Mountain, and they do it like once a month. They do close to about 20 or 30 cases. They have the same group of radiologists that interpret at Kings Mountain with Cleveland Regional, and we have the capability to do it at Kings Mountain. We have the MRI in the compound, and we have CT. We have all the diagnostic tests, ultrasound. They are all done in-house. So we don't have, now we have the cardiologist, the Sanga Clinic, who are there now, and they are helping us tremendously. So Kings Mountain is actually has the wide scope and range of services that they provide, and we have not had problems taking care of patients. In fact, most of the cases that we see there, we do them there. The patients that we transfer out of Kings Mountain are patients that really need more than what a small or medium-sized hospital can provide. Most patients that we transfer are patients that need what we call tertiary care, which means they need super specialists. I'm a vascular surgeon. I'm one there. Now, when I have such a case that not only there are many opinions and varied opinions to do that, you want to have that type of patient be in a center where before even he is operated on, the case is presented to a group of other surgeons who will say, "Well, I will do it this way, I will do it that way, or I will do it this way, I will do it that way." And by consolation of those opinions, our patients get the best care. Those are the patients that I would refer, and they're not that many. I mean, say less than 2%. I see patients that go to different hospitals, and what my patients have told me is that they are surprised as to the after care that they get at Kings Mountain. They never really known about the hospital, and this is their first time going, and they don't mind going back there. And that's because of the aftercare. Patients like that, and I think that is because of the attention paid to them when they are in the hospital. I really think that I encourage patients to go and see for themselves. There is a hometown atmosphere in Kings Mountain. They feel very proud about their hospital. They feel particular about things that happen in Kings Mountain. They want to make sure that their hospital thrives, and I encourage that. I think that that's a unique thing with a small community. I recall when the mayor of the city would come through the emergency room and make sure that things are. You don't see that frequently. I mean, that's great. I like that. They want their hospital to do well, and they support it. Most of the people that work there are from Kings Mountain and the surrounding area, so they do well.